Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Hospital, Chennai. I specialize in hip and knee surgery, and in this video, I will talk to you about how life is after a knee replacement surgery. Knee replacement surgery has become very common nowadays, and in our practice, most of these surgeries, over 90% of them, are done under spinal anesthesia, where the patient remains awake through the procedure and afterwards. They are given some mild sedation just so that they can sleep, but general anesthesia is generally not required in most of the cases. It is only an exception where we give general anesthesia. So when they come out of the surgery, which generally lasts about 1.5 hours, they are able to talk to the doctor, they are able to talk to their relatives or friends. So we keep them in the recovery unit for about 2 hours, where we monitor their blood pressure, heart rate, ECG and saturation. And generally, if everything is fine at the end of 2 hours or so, we generally shift them back to their original room. Most of these patients do not require an ICU stay or ICU observation. The only rare exceptions, like people over 80, people with either heart conditions or other serious problem that requires a little bit more intense monitoring, we occasionally keep them in the ICU for observation. Otherwise, they generally go back to their ward, and if the surgery is in the morning and by evening they are otherwise okay, we make them stand, take a few steps with the walker. Generally, post-op day 1, meaning the day after surgery, first day after surgery, we can generally make them stand and take a few steps. This is the goal for day 1. On day 2 after surgery, we make them walk on the corridor with the support of a walker. Generally, our physios help them do this, and most of them are comfortable doing this. On this day, pain is generally quite well controlled. We usually give a nerve block for the first 2 days, which is like a catheter placed around the nerve that goes to the leg, and this gives a medication slowly for 2 days so that the pain is very much manageable. By 2 days, even the nerve block is off, and we convert everything to oral medications. Generally, injectable medications are not required beyond this stage. We also convert antibiotics or stop intravenous or injectable antibiotics on day 2. So day 2, they are able to walk. Generally, a dressing is done on day 2. Next day, that is day 3, we start them with knee bending. They can be allowed to bend the knee. We also help them go to the bathroom, sit in the commode, and then get up from it. Our physios are quite well trained, and they are expert at doing this. On this day, we also help them climb a few steps, 3 or 4 steps with a walker. And by this time, they are generally ready for discharge on post-operative day 3. We send them home. So when they go home, they are reasonably independent. They can use a walker, they can walk to the bathroom, come back, they can dress themselves, meaning they are reasonably independent and can take care of most of their daily needs. The only thing is that they cannot carry anything and walk because they are using a walker and their hands are gone for the walker. And this is generally the routine for 3 to 4 weeks. We encourage them to be as active as possible with the walker, walk as much as they are comfortable with for the first 3 to 4 weeks. Generally, there is a dressing check done at 2 weeks, and then we call them after a month. In the meantime, they have to continue the exercises that have been taught by our physiotherapist. They are taught the initial exercises, and they are given a sheet on how to do the exercises after they go home. More than 50% of our patients are able to just see the exercise sheet and do it themselves. They do not require a physiotherapist to come and do something for them. Even if a physiotherapist is coming, it is their responsibility to do the exercises themselves with the help of a therapist. The therapist will help you do the exercises. Ultimately, the patient has to do it. There is no need for any forceful knee bending, no need for anybody to push you to bend the knee or any painful maneuvers generally as a part of our physiotherapy routine. So by 4 weeks, most of them are ready to get off the walker, meaning they are ready to walk without walker support, initially for short distances, and then over the next 2 to 3 weeks, even longer distances. By 3 months, we expect 80% of the pain that was there before surgery to have been disappeared, and by this time they are quite independent. They can walk without walker, go outdoors, walk to the shops or even to a temple, and take care of all their daily needs. Some of them are able to sit on the floor with their legs straight. 50% of them can do this. 50% cannot bend their knees and sit like cross-leg position. That is difficult. So we generally do not have it as a mandatory expectation before surgery. The main aim of the surgery is to make you walk, climb stairs without much difficulty, sit in a chair, get up. You can sit on the floor with the legs straight, but bent leg sitting may not be possible in all patients. The recovery continues even after 3 months. The last 10 to 15% of recovery takes another 3 to 6 months. So by about 9 months to 1 year, most people after a knee replacement, they can walk about 2 to 3 kilometers if they are otherwise fit. They can cycle. A lot of our patients cycle 4 or 5 kilometers without much difficulty. They can swim. Some of them who are active even get back to minimal sports like shuttle or doubles tennis. So life after a knee replacement is generally about 90 to 95% of normal. You can do most of your activities, even some minimal sporting activities. Thank you.